So what I'd like to do now is if Laurent Vandebrouck could join us from Qualcomm Life and join the discussion. So let me introduce you to Laurent. Laurent is the Senior Director, or is a Senior Director of Business Development for Qualcomm Life, which is in fact the health division that we referred to since Don had some ties with Qualcomm earlier. And Laurent is based in Europe and developing the end of things in Europe. He has 25 years of experience in the telecommunications industry and has worked across Europe, the Middle East, and Africa. So it's great to have you with us, Laurent, and this whole, I come a little bit, at least with the angle of the ICT side, so it's great to have a compatriot, because one of the big things that needs to happen with digital health, and Don, you referred to it, is there's many things that need to come together. Partnerships are essential. And of course, one of the big silos that needed to be broken, of course, it's been broken to some extent, but there's still many barriers that need to still come together, is the world of health and ICT coming together. So here we have our ICT world talking. So Laurent, if you could tell us a little bit, in fact, Qualcomm Life, what it does, and what are in your experience, some of the challenges that you're facing in the development of the Qualcomm Life.
Yeah, thank you, Florence. In fact, Don provides some really good example of what Qualcomm is doing in healthcare, so that will allow me to be pretty short. I mean, in this description, as mentioned by Don, so Qualcomm Life is a service operator. We are an enabler in healthcare. We provide to our customers, I mean, all the wireless communication means and all the infrastructure, the cloud that they need in order to wirelessly and securely collect the medical data generated by many different medical devices. So you were talking about the interoperability and this need for interoperability between medical devices. That's exactly what Qualcomm Life is about. That's exactly what we try to achieve and what we deliver to our customers. That's the interoperability between the medical device deployed in the home of the patient for the remote monitoring of patients with chronic disease, or patients that can be also on the move. So Don shown the TwoNet hub that you plug in the power supply in the home of the patient for collecting the medical data generated by many different medical devices installed in the home of the patient, whatever, if the patient suffers from COPD or heart failure or diabetes. So we do that through this physical hub or through what we call TwoNet Mobile, which is an application that you download on a smartphone and which transforms the smartphone into a medical data gateway and hub. So we do that as an enabler. We do not deliver the services directly to the patient. Our customers do. So who are our customers? Our customers are either big pharma, such as Novartis or Roche, that use our infrastructure and wireless communication means and kits, medical device kits for adherence programs, for instance. Our customers can be healthcare authorities or hospitals for the remote monitoring of patients with chronic disease from homes, and can be for more, in this case, coaching or prevention, can also be chain of pharmacies or insurance companies. So that's what we do today at Qualcomm Life. So to answer now to your question about the challenges that we experience in the adoption of telehealth or telemedicine, but telehealth more precisely because that's what we do. I think there are two main challenges in Europe, and I will focus on Europe, of course, not on the US market because the situation is completely different. But in Europe, I think the first challenge is the fact that the market is really fragmented. Each country, not to say each region, has its own policy or its own arrangement and business model, which lead to a difficulty to have pan-European initiative and cooperation between healthcare authorities. That's the first challenge we experience in Europe. And the second one is the difficulties to go from proof of concept to mass market adoption of telehealth services for the remote monitoring of patients with chronic disease. It's incredible the number of proof of concept or trials or clinical trials to which Qualcomm Life has participated as an enabler, providing all the means and all the tools required to operate these services. But once we have to go to mass market adoption, then the healthcare authorities very often have difficulties to put the required business model and or reimbursement mechanism in place to generalize the solution. It will come. It will come. In some countries, such as in Scandinavia, for instance, in Denmark, it's already the case. I mean, there are already pretty good and pragmatic cooperation between the municipalities and the hospitals to deploy telehealth services. In countries like France, it will be a little bit slower because it's more a centralized system, healthcare system. However, there are already some good initiatives that are launched, such as TSN, Territoire de Soins Numériques, Digital Healthcare Territories, as we need to speak in English, that are a good sign that the regions, 6 or 5 regions in France have decided to invest in e-health and health service platforms. So it really goes in the right direction, but the speed of adoption is really different country by country.
Mm-hmm. Yeah. Thank you so much, Laurent, on this. You talk about this challenge, and in fact, there are still, in this ecosystem that needs to come together for the scaling, there's still a lot of people to convince. And you mentioned the insurance. I mean, to me, they are part of the eventual business model and ecosystem. And since we are still in the phase of having to convince, I mean, here we have digital health gurus, but they don't need to be convinced, but there's still a lot of people in the ecosystem that need to be convinced. What some of the evidence that has come through that you can maybe tell the audience about through some of those proof of concept that you mentioned? Can you mention 1 or 2, particularly relevant numbers, perhaps?
Yeah, certainly. I mean, there are 2 main things that always come out as an outcome of this proof of concept and trials that we powered in Europe in different countries. First of all, the benefit on the quality of life of the patient. Again, I mean, I think we need to focus on the patient and the benefits of all these things for the patient himself. I think it's really obvious. I mean, following 2 to 3 years of use of this medical device kits installed in the home of the patient for the remote monitoring of his disease and these parameters, the patient really enjoy staying at home instead of visiting the hospital or the GP once a week, once a month, or several times a month, I mean, to check the parameters, and sometimes just going to the hospital just because he was stressed and not necessarily had parameters not in line with the protocol. So that's an important point, and it always happened in the different trials we participated to in Europe. It just requires 2 major things, in fact. The first one is that the medical devices provided to the patient are easy to use and well designed for use by the patient himself and not by a GP, and that requires specific device. And the second requirement is to have a web portal that will visualize the data to the GP, to the clinician, to the hospital, that really filter the information, filter the data, and just generate the alarms to avoid that the GP, the clinician, and other professionals are saturated by the data and by the information. That's 2 key important points. And the second major benefit we experienced through all these proof of concept and trials in Europe is the reduction in the impact and benefits for the hospital himself through the reduction of the number of readmissions in the hospital. That's, in all cases, decreased between 50 and 80% for all the trials we have participated to.
50 to 80%?
50 to 80.
Oh, that's a very impressive number. And so when you say, we're doing proof of concepts and, that has to, and it will come. You said it will come, meaning the scaling, right? What do you think needs to happen still? I mean...
as I was saying, I think it requires, I mean, for the case of the big pharma, for the case of the medtech, for adherence program and connected therapies, it's different because the ROI for them, it's obvious. For the case of for RPM, so for remote patient monitoring, and for the case of the hospitals need it. I mean, they all say that they are in a critical situation. The number of patients with chronic disease increase rapidly, and simultaneously, in most of the European countries, the numbers of beds available in the hospital decrease. So, I mean, they need to find a way to avoid that these patients come back to the hospital. And what we experience today, following all this proof of concept, is very intensive discussion between the hospitals and their local regional healthcare authorities to find a business model and a reimbursement or a reimbursement mechanism that can cover the cost associated to this telehealth services, adopted and generalized to all the patients with chronic disease. There, as I was saying, I mean, the Territoire de Soins Numériques is a good example where in France we go in the right direction, we experience the right trial, we put in place the right e-health and m-health sales platform to validate these business models, but it will still require 2 to 3 years, but it goes in the right direction.